Hello and welcome. Thank you for joining us for Uncovering America's Best Kept Secret Family Resource Centers and Family Resource Center Networks. My name is Jennifer Green, and I will be your presenter for today's webinar. A couple of quick housekeeping items to get us started. If you're joining us online, you may listen in using your computer speakers. If there's also a Zoom phone number if you should need to connect via phone. Your line has been muted to minimize background noise. We do have a tech online with us today to support us throughout today's presentation. And there will be a link in the chat for you to see all of the presentation handouts for today. And the chat section is open. We appreciate your engaged participation today. So use the chat feature to say hello and connect with us. If you have a specific question, we ask that you use the Q&A portion of your Zoom panel. As I mentioned, Cheryl is our tech today. So should you have any tech issues as we go along, feel free to private message her and she can assist you with any technical difficulties. After today's webinar, if we are unable to answer your question, we will follow up. Someone from our team will follow up to answer your questions. We always appreciate your feedback, and we review all of the evaluations. So a brief survey will pop up at the end of today's webinars, and we appreciate you taking the time to fill out information in that. And I think that is all. So let's jump right in. As I mentioned, my name's Jennifer Green. I'm the Senior Manager of Membership and Events for the National Family Support Network, and I'm glad to be with you today. So before we get started, I wanted to take a quick poll. There's going to be a poll that will pop up on your screen. Take a look at the map here before the poll launches. So the first question is, where are you joining us from? So as that poll pops up on your screen, if you can select one of the options there. Thank you for filling out the poll. We'll just give you about 20 seconds. All right, thank you for filling that out. We can close that and share with all to see. Let's see who is represented today. All right, so Midwest is the winner today. We have 39% of our folks on the call are from the Midwest. We have a lot of representation in the South and the West as well as a few from the Northeast with no Canadians on the call. So great. I see representation across the whole US. All right, the next poll I'm going to launch here is, what is your affiliation? So I know we have people across the US. If you can take a minute, fill this question out. What is your affiliation? Do you represent a family resource center, maybe a family resource center network, another type of family support program? Are you in education, government, child welfare, or other, or a private funder? If you select other, if you could put your response in the chat, and I'll review the responses there. All right, thank you for filling out this poll. So let's see where and what affiliation everybody on the call is with us today. Wow, so across the board, I do see five of you guys selected other. So if you can take a minute, check out the chat, put your answer in there. So definitely some FRC and FRC network representation, other family support programs, some educational space. All right. Thank you for answering in the Q&A. It looks like the chat was disabled, so maybe the tech can help out there. Thank you for flagging that. All right, so let's try again. Are you able to chat now? But thanks for answering the Q&A. So I see a community coalition and appreciate you answering there. So yes, use the Q&A. We will navigate there. All right. And the last question, as we will get started. Okay, let's see here. There we go. Chat section is open for you now. All right, so Cheryl, before we get started, if you can confirm or if someone on the call of our 40 participants, are you able to chat out and we'll ensure it's working correctly? I see Cheryl can text. Thank you, Sarah, representing a community foundation. All right. Well, I'm not sure what's going on with the Zoom features today, but we still have a way to communicate on this call today. So we'll be utilizing that Q&A portion for sure. Thanks so much for engaging with us and appreciate your flexibility here, as technology does not always work in our favor. All right. So to get us started, here's our map for today. We're going to talk through family resource centers. We'll discuss family resource center networks. We'll dive into the National Family Support Network. And at the end, we'll share out some resources and opportunities for you. Great. So the concept of family support, it dates back to the late 1800s with the creation of settlement houses in major metropolitan areas such as New York, Boston, Chicago, and San Francisco. And settlement houses provided the large number of immigrants that were entering the country at the time with support, job training, maybe English classes, social advocacy as means to assist them in understanding, adapting to, and succeeding in American society. And this slide right here illustrates the Good Samaritan settlement house that is located in San Francisco. And on the left from 1913, and on the right, you can see the modern look as the Good Samaritan Family Resource Center that continues to serve and connect with families today. So originally serving, yay, thank you. I see the chat blowing up and I got distracted for a second. It's working. Thank you. I am so appreciative. Thank you. All right. So originally the Good Samaritan serving those immigrants from Europe, Good Samaritan has now evolved with the changing community needs and shifts in the neighborhood population into a family resource center serving the Latino community. And thousands of family resource centers have emerged organically across the country, yet their existence is still largely under the radar as America's best kept secret. And a family resource center is a community or school-based welcoming hub of support, services, and opportunities that are designed to support families to be strong and successful. And the top image is from a community-based family resource center located in Vermont. And the bottom one is from a school-based family resource center in Kentucky. And FRCs work with families with an approach that is not only two-generational, but multi-generational. It's strengths-based and family-centered. And each of these concepts is important. So multi-generational, have you heard of two-gen work or two-generational work? Well, family support is the original, not just two-gen or multi-gen work, as programs work with children, parents, and grandparents as well. And strengths-based, because we see that families as having their own strengths that we want to support them to build upon. And the last thing is family-centered, because everything that we do has families at the center. Family resource centers are designed for all families, not only low income or highly challenged ones. So they support, and the support that they provide, it's non-stigmatized. It's making it more readily accessible. And programming is typically provided at no cost or low cost for participants. And the image on the screen here is from a Family Success Center in New Jersey. There's actually 57 Family Success Centers in New Jersey, in all of the state's 21 counties, with growth still occurring. And each county in New Jersey has at least one, and if typically more than one, Family Success Center. That includes highly affluent counties as well as highly challenged counties, because again, the belief is that all families could benefit from access to support for two of the most important roles that you can play, that we can have as adults, being parents and being spouses or partners. And two of the most important roles that we actually don't receive support or training, we typically don't. And so hence the value of universal access to family resource centers. I want to launch a poll and see, have you heard of the Strengthening Families Protective Factors? So how familiar are you with the Strengthening Families Protective Factors? You can launch the poll on the screen here. Are you familiar, not familiar, somewhat familiar, or very familiar? Give you a few seconds to fill that out. Thanks so much. All right, let's close the poll and see how familiar everyone is. All right. So I see a gamut across the board. So from pretty evenly split across. So not familiar, somewhat familiar. All right. So with that information, the Strengthening Families Protective Factors come from the Center for the Study of Social Policy. And research has shown that these 5 protective factors increase family stability, they enhance child development, and they reduce the likelihood of child abuse and neglect. So as we're working with families, we want to support them to build these protective factors because we know that they make a difference and a positive difference. And so you can see here, the protective factors cover parental resilience, social connections. Parents need support. And so having those connections, concrete support in times of need, those, meeting the needs of the parents just to have the concrete supports, whether that's rental assistance or housing. They also, you can see knowledge of parenting and child development. So knowing how do children grow, what is developmentally appropriate, and social and emotional competence of children, which now more than ever after going through a pandemic, we understand the high need there. So all of these are available for more information on the Center for the Study of Social Policy's website. And family resource centers, there's actually no dedicated funding for FRCs, unlike Head Start, home visiting, or after-school programs. Yet there are more than 3,000 of them nationwide, working with more than 2 million people annually. So why are so many public and private funders at the state, county, city, and community levels choosing to invest in FRCs? Simply put, FRCs are just a good idea. They are cost effective, they're highly adaptable for various communities, be they urban, rural, or ethnic, and they have demonstrated successful outcomes through multiple external evaluations. And family resource centers are conveniently located hubs. So they bundle and they co-locate many services that may be familiar to you, such as home visiting, evidence-based curricula, parenting education, health screenings, play groups, or fatherhood programs, family counseling, and food banks. And because FRCs are shaped by and responsive to their communities, we often say, if you've seen one FRC, well, you've seen one FRC. They're developed, they reflect the needs of that community. And so you can see on the picture here where a needs assessment was being done in I believe this was in Chula Vista County. So a needs assessment determining what is needed in that area. And family resource centers at the same time, despite their organic development, there is remarkable similarity in their most common service areas. And this data here comes from a national study funded by the Robert Wood Johnson Foundation that the National Family Support Network worked with a research institute to conduct. And so these are 4 of the common service areas that we see. And so starting with parenting support, this begins, it's on a continua. So looking at parenting workshops on the far left, this is that lighter touch with parenting support, providing parenting workshops, Then moving into parenting support groups. So is it a dad's group or a first time moms group or first time parents group? Then a little bit more intensive is the parenting education series using an evidence-based curricula. So maybe they're have a parenting program there. And then the more intensive touch is that home visiting. So family resource centers, as home visiting is a part of the program, then families have a connection to come to there. So access to resources is another common area that we see with family resource centers. Same thing on a continua. So um, wider touch being that enhanced information and referral, um, more moving down the continua or across the continua is concrete support. So providing rental assistance and housing assistance, um, working with families over time to address those family identified goals. And the last more intensive is the co-location of resources. So we've seen this with maybe it's a WIC program where it's actually co-located in the space. And so parents don't have to go across the community to find resources. They're all located conveniently right there. Another common service area that we see is child development activities. So having a space for child development activities as well as parent leadership development. So important to have a way to build upon the strengths of parents. And family resource centers build, not only do they provide programs, but they build communities of peer support for families to develop social connections that reduce isolation and stress, which are highly correlated with child abuse. And I'm going to share a screen, a video here. This is Sheila Harewood in Corning, New York.
People underestimate how
I'm not hearing that. I think you have to unmute, Jennifer.
Sorry about that. Looks like when I reshared my screen, it did not share my sound. So let's try that one more time.
people underestimate how challenging it can be of trying to balance parenting and effective parenting, mind you, and not having a space to actually vent and communicate and learn alternate ways of rearing their children. People don't realize it is a support that they need, not once in a while, but like all the time. I could see the excitement, the smiles. It is the same every single time they walk in the door. The staff is so friendly, the space is so inviting. So it gives us an opportunity to just like kind of brush off life and then escape into this space where they could just relax, and it nourishes us, it feeds us, and allows us to just make, take all of that and positive energy and do life. Regardless of anyone's socioeconomic status, regardless of racial background, educational level, the need is exactly the same. It is a place, a need for a place to be able to sit down with other parents and do life together. And that is something that is so impactful. Once they have that support system in place, it has a ripple effect. And we will glean from that because our communities will thrive. The more support, I mean, it's just, it's like a domino effect. People underestimate.
All right. Thanks to Sheila for sharing the parent story of being engaged in a family resource center. So now that I've described FRCs, I'm going to launch a poll to ask if you've seen programs that look like FRCs in your state. So you can take a minute to fill out this poll. Does your state have programs that look like FRCs? All right, we can close that poll. So let's see here, to your knowledge. All right, so 70% have seen an FRC in their state, and I see a couple of folks that have not, and a handful, just less than a dozen who are not sure. Great, thank you for filling out the poll there. Great. I hope this information has been helpful, and for those of you who haven't seen an FRC or don't see one in your state, I hope you can connect and check out the website to learn more as well. And so this slide here was developed in partnership with Casey Family Programs, which is one of the National Family Support Network's national partners. And it illustrates how FRCs work with families across the continuum of potential involvement in the child welfare system. So on the screen, you can see primary prevention, and you can see the Family Resource Center role versus the Child Welfare Agency role versus federal child welfare funding that could be utilized. So going across the top there, on this chart, you can see what does primary prevention look like, what is differential response, and what does that look like across the various roles, and how do those connections take place, as well as the looking at an open child welfare case and how can a family resource center play a role in that. So maybe hosting supervised visitations or supporting kinship care providers. And then the last column there being post reunification. So providing services and supports for families who have been reunified. So you can see it works across the continuum of child welfare and being able to leverage and fund FRCs to support families across the prevention continuum. And that tool is available in the handouts that is in the chat, as well as on our website. And so looking at family resource centers, for this research came from Alabama, and for every $1 that's invested in family resource centers across the state of Alabama, they've actually received the return on investment here of $4.93. So that's immediate and long-term consequential financial benefits. And looking at, so that's the increase there, the amount of impact. Then we also have, looking at a University of Chicago study, actually found that neighborhoods with FRCs had 26% lower rates of child abuse and neglect investigations than similar neighborhoods without them. So imagine the amount of support being available in that community, and the decrease in the amount of child abuse and neglect investigations across the United States that can support families. And in Teller County, Colorado, which is a semi-rural county outside of Colorado Springs, since their human services agency moved to a differential response system back in 2016, referring screened out families to participate in FRC services on a voluntary basis, they have seen a 63% drop in their child abuse rate. And they have only one FRC in the whole county. So think of not only the huge cost savings, but the human cost savings. So many families that are now spared entry into a highly traumatizing system that no family wants to have anything to do with. And once you are in, that you may never get out of. And the latest data comes from research studies supported by the Casey Family Programs that illustrate the specific child welfare system cost savings, both in semi-rural Teller County and urban Orange County, California. So urban and rural populations, and you can see the numbers there on the screen. And in Colorado, you can see their executive summary, which is also listed on our website, that families who have participated in FRCs, that they've demonstrated statistically significant improvements in these key areas. So looking at health, looking at concrete support in times of need, family functioning and resiliency, the attachment there, economic self-sufficiency. So many different across the spectrum improvements for families. And the stories go on. So Kentucky has 888 family resource centers, all of which are school-based, and it is the second largest network in the county, in the country. And you can see the investment there and the impact that it's having on the school systems and all of the families there. So it was part of their statewide education reform. So people want to know, what does it cost to run an FRC? Well, that is going to vary. It is different across various locations. So you're looking at your cost of living, what type of programming is available within your FRC, and the physical space that is needed. But we can say on average, a typical community-based FRC, such as New Jersey, has an annual budget between $240,000 and $300,000. And there's 3 to 4 full-time staff. Whereas a school-based FRC that's located in Kentucky, you're looking at, they have a budget of anywhere between $33,000 to $82,000, only 1 to 2 full-time staff and space, and understanding that they have a variety of in-kind services. So you can see a wide spectrum on what does it cost to run an FRC. And across the country, they are funded in various ways. So mostly by state, county, and municipal governments. Some have also leveraged, if you're familiar with the federal funding, community-based child abuse prevention. There's also support from foundations, in-kind support, various donors, corporations who are supporting FRCs. So mostly by state, county, and municipal governments, but we have seen differences across the US. And FRCs and Family First and how that comes into play. They were able to leverage family resource centers to provide the 12 months of in-home parenting skill-based programs for parents or relatives who are caring for children. And so if they were quote unquote candidates for foster care, right? So in this, you can note that in-home means that the child has not been removed. So they're still in the home, and that the services need to be provided in the home. So they're not removed from their family. The FRCs were able to provide programs for the Title IV Prevention Services Families First Act. And as well, FRCs, New Hampshire was actually the first state to do this, where they leveraged FRCs to implement kinship navigator programs, and networks of FRCs were able to support successful planning and implementation of the Family First Prevention Services Act, so FFPSA. And notably, 2 of the things families have most been seeking support for during the pandemic was family support and access to resources. And so FRCs showed up during the pandemic, and this was remarkable during the pandemic, to support families of all kinds. We saw that parenting support, access to resources were highly needed. And as you know, they're the bread and butter of family resource centers. So FRCs, they showed up, they rolled up their sleeves during the pandemic, and they were able to illustrate how to help support families through the crisis. And these photos here represent some I'll talk you through these examples. And you can see on the top left here, we had drive-by shows of support for families in Kentucky. We had infant supplies that were working with distribution in Colorado on the top right there. On the bottom left, there was virtual bilingual story time in Massachusetts. And then on the bottom right in Kentucky, the school-based FRCs actually took on the delivery of free lunches to students while the schools themselves were closed. And so they're already there in the community. They were able to show up for families and jump right in, keep their doors open, and help families during one of the most difficult times. And so I want to call your attention here to really this remarkable development that's happened over the past 2 years. And parenting, like I mentioned, parenting support, in particular, parenting stress support and access to resources. So because of FRC's strong response to support families during COVID, they're emerging from under the radar. So in red and blue states across the country, they're committing new funds to support them. And Alabama was actually the first to kick off putting FRCs as a line item in the state budget. And from that, we've been able to see just the implications and the unprecedented investment across the country. So you can see here, I mean, this is pages and pages of funding increases and support across the country. So Alabama, California, Colorado's made investments. We see Hawaii, who's now launching a prison-based FRC pilot, establishing statewide FRC coordinators to support their state. Kentucky, you can see the numbers from 2021 to 2022. They just had a $9.4 million investment from the state general fund. And this sort of movement, it's unprecedented. So the word of today, you're on this Uncovering America's Best Secret. Well, good news is the secret's getting out there and folks are finding out about this this best kept secret. You can see the investments in Nevada and New York's expansion to now 30 FRCs from where they started. That's over $15 million being invested. Texas, Utah, Vermont, and Washington all increasing their funding across. Oh, one more slide. West Virginia even. West Virginia is a new expansion as well, so increasing up to 40, and Wisconsin as well. So across the country, states are committing funds to support families in FRCs. So now we've talked about FRCs, we've talked about the funding their FRC networks and how we define them is that they consist of 2 or more family resource centers. So this is one level up from an FRC. This is an opportunity. They coordinate the quality support for families. So being able to convene them together, pull together all of the family resource centers to serve that backbone entity to leverage and coordinate collective impact across the work that's happening across the state. And we see they are convened in various ways. So they may be independent nonprofit, coordinated by a public or private funder, or led by FRC directors in a volunteer leadership. So not only have cities, counties, and states hit upon the value of FRCs, but they've also hit upon the value of networking them together. And this data here comes from a national study that the National Family Support Network worked with a research institute in Colorado. And I'll walk us through the common functions of a family resource center network. So the first one being, we call it the 4 C's. So connectedness, coordination, cooperation, and collaboration amongst the members. So bringing the members together to support that coordination. Providing training and technical assistance. So a lot of networks have implemented the standards of quality for family strengthening and support, or various technical assistant needs across various the needs across their various members and FRCs across their state. Some networks also work on advocacy, policy, and legislation. So they may have a lobbyist on their team, and being able to provide support to support all of the family resource centers at the policy and systems level. And then also a way to provide and maintain a shared data tracking system. So understanding what does it look like across the state with family resource centers, and the data, being able to pull that together and analyze, having that data tracking system. And we talk about family resource centers in two ways. So first is the stages of network development. So the emerging phase is the beginning phase. You're just getting started. You're determining who will be at the table. What do you want to focus on? So who's going to be there? What are you going to be focusing on? Then as you move on to that 3 to 5 year mark, we call this the evolving stage. And this is the sort of toddling phase. You're learning, you're further developing. You may hire a contractor or your first staff member, and your network really begins to have more structure and capacity to do more. And then the last type, stage of network is the established phase. So this is when you typically have your staffing, you have a track record of activities, and an interesting characteristic of this stage of development is that networks have maybe weathered a crisis and decided to stick together. And so that is stages of network development in the 3 categories. Now, the other way that we categorize family resource center networks is by type of network. So volunteer coordinated, as you assume in the name, volunteer coordinated, it's actually led by family resource center directors themselves in voluntary leadership positions without paid network staff. So the key there is no paid staff to do the work. They are doing this work on top of the already busy job that they have of running a center, and now they are convening together. Funder coordinated is another type of network, and it could be led by a public department or a foundation that both funds and convenes the members in the state. And the last category there is independent nonprofit. So independent nonprofit, it's staffed by an independent nonprofit corporation, organization, that functions as sort of a membership alliance. So with members paying dues. And an example of an independent nonprofit type of network is Colorado and Maryland. So those networks, they may raise and distribute funds, serving as an intermediary or not. And an example of a funder coordinated is New York and Nevada, and the volunteer coordinated, an example is West Virginia. So the National Family Support Network was co-founded by the 8 state networks listed here on this map, represented here. These were networks of family resource centers. And for the first 4 years of its existence, the National Family Support Network had no paid staff, and the steering committee members coordinated the work of the NFSN as volunteers on top of their jobs of running state networks. So volunteer coordinated until 2015. And now, over the last decade, the National Family Support Network has now quadrupled in size to now have 37 member networks, 30 that represent 36 states and the District of Columbia, that represent more than 3,000 family resource centers that serve more than 2 million people annually. And the newest members to join us are Louisiana, who joined us back in June, and North Carolina, who joined us back in April. And the National Family Support Network mission is to promote positive outcomes for all children, families, and communities by leveraging the collective impact of state family resource center networks and championing quality family support and strengthening practices and policies. And so the vision, in summary, is about turning the whole map that I just showed you green so that all families will have access to quality family support services in their communities that are provided by FRCs supported by strong networks. And we have 3 areas of work that we focus on. So the first being convening and connecting and convening member networks to enhance their effectiveness. We do this through peer learning and mutual support, connecting our members together, bringing them together. The second way is promoting family support best practice and evaluation. So I had mentioned the standards of quality earlier. The standards of quality for family strengthening and support are standards that are available. I'll go over those in just a bit, but that's one way that we're raising awareness of what quality family support is. And also the third bucket, raising the visibility of the value and impact of FRCs and FRC networks. So in order to really increase support for families and being able to spread the word about the great work that's happening across the state, across the nation, states in the nation. So the National Family Support Network membership, I wanted to cover with you all. We look at criteria here being that it is 2 or more family resource centers that are coming together. We recognize that networks come together at different points on a journey, and networks can be at any stage. So even if you are in the very beginning, that emerging phase, that 0 to 3 mark, or you have been an established network, that is the criteria. You can be anywhere on the continua. And also, we recognize one network per state. It's very important that one network for membership. The dues for membership actually cover the whole state. So regardless of the number of FRCs, so whether you're like New Jersey and you have 57 centers, or you're like Kentucky who has 888 family resource centers, your membership dues actually cover the whole state. And so you can see the cost here for new member dues being a slightly discounted rate from the ongoing member renewal dues. So $700 for a volunteer coordinated, or $1,000 for others. So that's when you first join the journey and become a member network. And those dues are good for 1 year until the renewal period. And you can see their nominal fees to become a part of the national network and be a member, to connect and take advantage of all of the resources and the peer sharing and peer learning available. So the standards of quality, I see a question in the question box here, so I hope I answer all of your questions here. This is one of the ways that members support do their core work with training and technical assistance. So they may provide training on the standards of quality. And so the standards are actually the only, they're designed for all stakeholders, so that whether you're public department or you're a foundation or a community-based organization, or you represent a family, all of these tools and assessing quality practice are available. And they're unique because they actually integrate 2 frameworks. So the principles of family support practice and the strengthening families approach. And it's evidence-based, research-based, evidence-informed 5 protective factors that I shared earlier. And they are the only standard set within the family support field. They create common language across different kinds of family strengthening and family support programs. So just like home visiting programs, family resource centers, and child development programs, the standards actually reach across all of those types of programs. And they help ensure that families are supported and strengthened through quality practice. These standards, as well as all of the implementation tools, are free and available to you on the website. So we don't have a price tag on them. We want them to be in the hands of all programs and communities to support families. And the standards themselves were revised back in March of 2021. And now they reflect with the lens of enhancing diversity, equity, and inclusion. So advancing diversity, equity, and inclusion, as well as relevancy for the United States and Canada. So a committee came together and reviewed the standards, and then it was brought to the members to then be implemented back in 2021. And the standards themselves focus on 5 core areas of practice, as you can see here: family-centeredness, family strengthening, diversity, equity, and inclusion, community strengthening, and evaluation. And with these standards, there is a standard certification training. So the standards training is implemented across the states. You can see now over 13,000 individuals have been certified in the standards. We have 110 trainers across the US, and we have nearly 500 standard certification trainings have taken place. And so we've received, you can see the impact there, the readiness to implement the standards. We have various tools. So check out the website and learn more as well. And the National Family Support Network worked with its members to develop a blueprint for how to scale family resource centers and family resource center networks to ensure that all families have access to quality family support and strengthening services. And these are our 4 core areas that we focus on. So the first one being strengthening existing family resource center networks, establishing new family resource center networks. So creating that map, turning that whole map green, strengthening the family resource center workforce, as well as connecting and leveraging family resource center networks with other initiatives. So this is our blueprint, and you can check out more information on the website. And we use this blueprint not to just have a report, a beautiful report to put on our website, but that we are actually making progress. And so we hold ourselves accountable by sharing this publicly during our national briefing every year, where we look at how are we going, how are we moving the needle, and where are we headed next. And so we invite you to review this and see how you would be part of the ongoing journey. And the National Family Support Network has various national partners here. So the partners listed on the screen were part of the journey in the very beginning. So in the beginning, when the NFSN first emerged, the co-founders reached out to these organizations and entities that offered their support. So the U.S. Administration for Children, Youth, and Families, Casey Family Programs, Center for the Study of Social Policy, the Strengthening Families, the Children's Trust Fund Alliance, Families Canada, Friends, which is the National Resource Center for Community-Based Child Abuse Prevention, as well as Prevent Child Abuse America. And these partners regularly participate in National Family Support Network activities, and including we serve on each other's committees, we co-sponsor events, we present at each other's events, and we work collaboratively on joint projects. And we also work with collaboratively with other organizations as well. I want to pause here and see, I'm going to check the chat as well as the questions box. What resonates most with you from the information shared? fill in the chat there. What resonates with you? Thanks, Anna. So the variety and also similarity and how FRCs look. Yes. So there are similarities across FRCs, and also they're unique to the community there. You can see we did a recent webinar back in February where Hawaii talked about their Native community. We had a Native American FRC webinar as well, where you can see the uniqueness there. So each one unique to their communities. Thanks, Kurt. So the amount of FRCs out there and how much this is growing. Yes, it's so exciting. I had chills when I was talking about the funding that's growing in all of the states across the US, because the implications of that is supporting families. Thanks, Kurt. And Catherine, thank you. That these resource centers bring multiple resources to one hub. Yes, so making them more accessible to communities. So, I mean, imagine living in a space and in a community where families have access to it right there on their corner. That's in every neighborhood, that is the place that you would go to as a family needing support and connecting. Thank you, Janet. The long range nature of growing a center and growing the network over many years. Yes, I love these. Thank you for engaging in the chat. Thank you, Erin. Making more resources more accessible. Yes, in rural parts of the state. And that there's definitely some more information to share on that too, on how do you support communities with support rural communities to make access available. Yes. And we even have a family resource center webinar on our website where we talk about mobile FRCs as well. Thank you, Dee. This helps thinking about our community's readiness for FRC startup. Yes. Community-led. Yes, Adria. I know. It's grassroots, right? Like people are starting this. They know this is all, it's evolving and emerging. But like I said, the secret's getting out there, and we've seen states where they're dedicating more and more funding to this, to support this. It's unprecedented to see this and see how family support is evolving. So it's great. All right. Well, thank you all for that. If there's anything as well that you would be interested to explore more, you can add that to the chat as well. But I see the interest and the things that resonated most. But is there anything you would want to explore more? You can use the chat. All right. I'm going to share some resources, and then we will wrap up with a Q&A portion. So if you've had any questions that you've been stirring as I've presented this information, use your Q&A portion of your Zoom, and we will get to questions in just a bit. Thanks. Thank you, Felina. Yes, so Native American FRCs, there was a whole webinar presented and information on the website, so you can learn more about specific, it's targeted to a few that were highlighted. So you're here, you're part of the Webinar Wednesday series. So this is a regular occurrence for the National Family Support Network, and a way for us to spread the awareness. So upcoming at the end of August, we will have a network spotlight from the California Family Resource Association. And beginning in September, we will kick off with an overview of the standards of quality. So I gave a high level overview of the standards. this presentation will also include a New Hampshire implementation focus. So New Hampshire and how are they implementing the standards across the state. All of our webinars, as I mentioned before, are recorded. So you can go to the website, there's a resource, an archived library where you can look at specific topics, you can look at FRCs or FRC networks, you can see our member highlights. So we encourage you to go there, visit, and see. We know you can't always participate live, so the recordings are available. Another offering that we have is the standard certification training. So I referenced the standards. This is the certification training. It's available every fourth Thursday and Friday of each month. You can check out on the certification training page. You can look there. If your state provides this training, you'll see contact information for upcoming trainings. Otherwise, connect and learn about the open trainings as well. And you can also contact us separately to discuss bringing the training to your area. So right now it's virtual, but more information is available on the website. And another offering we have is the Developing and Sustaining Effective Parent Advisory Committee trainings. This is available. It's highly rated. It's unique in that it brings together an NFSN staff and an experienced national parent leader who bring the conversation. And the uniqueness is that it is the only training, we know because we looked for one, this is the only training that focuses on staff. So developing how do programs and staff work to develop parent advisory committees. So the staff focus there. And how do we get maximize the great potential of parent advisory committees? So you can see what's available online. Those are open trainings, the registration links, and you can contact us to also, if you would like to offer this for your staff only, we have opportunities to connect with you on that. The Together for Families conference is coming up in October, and this is the big tent event that brings together all parties involved in the family support and strengthening field. So all the player practitioners at the program systems, funder levels. It's co-hosted by the Center for the Study of Social Policy, one of our national partners, as well as Families Canada and our organization. So you can check out the website at togetherforfamilies.org. Registration is open. Space is limited, so I encourage you to visit there today and see what's coming up. But we have a variety of tracks. We have great plenary speakers who are coming to talk about parent leadership. We have our closing panel is going to highlight the parent leader, a real talk with parent leaders panel that's planned by the Parent Leader Committee who's putting on the conference. So we're super excited to be a part of this event and co-host. We have many resources available on the website, on the National Family Support Network website. So visit, see, we have member snapshots, which is all of our members' work over the past 3 years. You can see what have they done, how are they funded, what type of functions do they have. So there's an example on the slide of Alabama's. So if you go to our membership page, you can click on the state and see the story. So if you're here from a state who is a member, you can check out your own snapshot and your state snapshot. We have sample RFPs, evaluation plans, information about data management systems, as well as the tools that I shared and the standards themselves. So the standards of quality and the implementation tools, all available on the website. Some key services that we offer is to facilitate connections to NFSN member network, so we can help to connect the dots and connect those communications. We can present for key stakeholders, so maybe your children's trust fund or a public or private funder, somebody you're working with that's investing in Family Resource Center. So feel free to reach out as we can provide that as well. Providing technical assistance for Family Resource Center network development. This is our bread and butter. So reaching out if you need assistance. as well as providing trainings, as I mentioned, the standard certification trainings and the developing and sustaining effective parent advisory committees. So I'm going to pause here and open up for Q&A. My information is there, our co-founder and director's information as well. Andrew Russo, you can check, contact us, reach out if you have questions, and we hope to connect with you in the future. Let me see what questions I've had come up. And if you didn't get a chance to type a question earlier, feel free to add it now, and we will try to answer all that we can in this remaining 15 minutes. I see, Aaron, I believe I answered your question. So Aaron had asked about the common functions, standards of quality is one training that is provided for members. And the uniqueness of being a member is that in order to have trainers in your state, you have to be a member of the National Family Support Network, which then increases the quality of programming in your state as well. So that's one added benefit. And Audrey is asking, what are some common challenges that FRCs face? And to answer that question, common challenges, I mean, I think it's going to be unique across the country, and depending on the time as well. So funding, how do they provide funding? I think that's similar for various types of family support programs. Staffing, funding, things of that sort. Kurt asked a question as far as the standard certification trainings go. Is there a difference between the specific state trainings and the NFSN trainings? Great question, Kurt. So standard certification trainings, the difference is that the states who have trainers are available to offer that to their state and support programs and FRCs within the state. Whereas some states, as you saw on the standards map, that some states are white, and so they may not have trainers in their network yet. So if they are a member and they may be developing trainers, if it's a newer network. So the NFSN offerings are that we want to provide the space, the training across the US and make it available. And so virtual has made it pleasant to be able to do so and support across the nation. But that's one reason, the specific difference. So I would encourage anybody interested to visit the website and see if there is trainers available, and the specific point of contact will be listed on that standards training page as well, so you can know who to reach out to. Great question, Kurt. Thank you. David is asking, why isn't there federal funding yet? And there is currently no federal funding yet. Of course, the National Family Support Network is working with members to advocate on behalf of moving the needle in terms of funding and getting that, working with our federal partners to be able to talk through that and look at policies across. But why it isn't there yet, I do not have the answer, but would be happy to have another huddle with that, David. And every state is different, so we don't have a consistency across the US to be able to support family resource centers. So we continue to have those conversations at Capitol Hill and support our members to then support their own congressional staff. We do that also through the congressional briefing that took place back in July, to be able to highlight and share what family resource centers do and why they are so important, that they have the ability to support all families. And so it's an easy conversation, but being able to put the funding there to it. I like that you said not yet. I can't wait to present this webinar in the future where I'm telling you all about the federal funding that's available. Are there any other questions? I hope that I've answered all of the questions for you. Happy to continue the conversation if you want more clarity or more response to what I have answered already. But feel free to reach out, and I would encourage you all. The next step is to complete the evaluation survey. So if we do read these thoughtfully and thoroughly, and so if you can take a minute to give us your feedback, this will automatically pop up on your screen, and it'll include questions about identifying your next steps and what we can do to support you. So I hope you have a great rest of your Wednesday, and we look forward to connecting with you in the future. Have a great day.